So now that I started this, I don't know, I guess some of these videos will just be on the kind of spur of the moment as things come up to me. I was just thinking of then and now. 50 years ago, used to use a glass syringe that we had to boil every day to sterilize it, a disposable needle. Back then, it was a 26 gauge, 1/2 inch long. Now, the syringes are all plastic, disposable, 31 gauge, 3/16 of an inch in length. Comfort-wise, I like these new needles, but it's still, every now and then you do pierce yourself, and it still hurts a little bit. Back 50 years ago, to test your sugar, it was a urine test. There were no glucose meters where you can get immediate results. A urine test, gave you your sugar level, but how long has that urine been collecting and sitting in your bladder? That was telling you what your sugar was maybe an hour or 2 hours prior to taking. At least now with the glucose tests, you get immediate results. 3 seconds, 5 seconds, 7 seconds, however, the type of meter that you're using. So there is a big difference in control of and seeing where your sugar levels are. I know there's our new meters out today that continuous glucose monitors. The part that actually stays in your, pierces through your skin and is taped to your body, is good for approximately a week, and it allows you to see your glucose level every half hour, from my understanding. The monitors, from what I've seen, range anywhere in price from $600 to $1,000. And on average, the test strips that are used, they all seem to average out about $100 a week. So if you don't have good insurance, that's a hefty expense. $100 a week, you're looking at $5,200 a year just in test strips. The other thing that's becoming new is service dogs. You could train a service dog to sense a low blood sugar level and a high blood sugar level. The dog cannot distinguish between what is going on, whether it's low or high. He just knows the scent of the body when these parameters are trained into the dog. So he's going to, in some form or fashion, let you be aware that something's going on with your sugar level because it's not falling within the parameters of where you want it to be. And so he nudges you, or whatever they're trained to do at that point. At least that tells you that, you need to go and test your sugar to see whether you're on the low side or the high side. My understanding is that you can have these dogs trained for specific sugar levels. Say you want the dog to sense when your sugar drops to 75. And say you want the dog to sense when your sugar is at a 200 reading. This is all trained into the dog. So should your sugar drop to 75, your body chemistry and your odor of your body is going to change, and the dog will pick it up. Same thing if your sugar is at the high side of 200, let's say. The dog will sense your odors and inform you, hey, go test yourself. You're somewhere other than where you want to be, between the 75 and the 200. So that's what you do. You go, you pull out your meter, and you test yourself. Again, these are just going to be random videos I'm going to come up with, spur of the moment. I have no rhyme or reason of what these are going to be. But thanks.